Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day. This week we've been here Monday through Thursday. Next week it'll be Tuesday through Thursday, and beginning in June on Mondays and Thursdays. This is update number 50, coming to you live on Thursday, May 21st, 2020. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt, and me include Dr. Phillip Triffletti, an attending physician at Beth Israel Deaconess. Also, Tim Cruz. He is the Plymouth County District Attorney. Robert Eisenstein. He is a senior living consultant. And Stephen Cole. He's the executive director for the Plymouth Regional Economic Development Foundation. This time we're going to go and begin with Ken Tavares, the chair of the Plymouth Board of Selectmen. Welcome, Ken. And
thank you, Steve. Good afternoon.
Good afternoon.
The town is very. Hello.
Yes, go ahead. We have you, Ken.
Okay. The town is very busy. Okay. Right. Try this again.
Go ahead.
Hello.
We've got you.
Just wanted to report that the town is very busy this week, preparing for the Memorial Day weekend, where we know that a number of people will be out, and we're just asking everyone to please observe the protocols and enjoy what hopefully will be a different kind of Memorial Day weekend, but one that will be significant. Thank you, Steve.
Thank you. And that is Kenneth Tavares, and he is the chair of the Plymouth Board of Selectmen. He and the other members of the panel will continue with us. You can send questions to them at plymouthinfo@pactv.org. Each day we date stamp our presentation so you'll know when it's coming live, which this is coming live on Thursday, May 21. We bring together both officials as well as experts who are responding to the coronavirus. And at this time, we welcome back Dr. Phillip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil. Phil?
Thanks, Steve, for having me back again. My pleasure to be on the show. Yes, can you hear me?
We can. Go ahead.
Can you hear me?
We can hear you. Go ahead.
Okay, well, thank you. So, Steve, I'm going to start off with a quick story. Today about a patient of mine this week. It was actually my first patient to get COVID-19. He's a retired physician who is 83 years old and had a fever of 100.6 and was feeling weak and tired. So, he didn't really have much in the way of cough symptoms or other respiratory symptoms. He is a disabled gentleman with some Parkinson's disease, and he relies on 4 caregivers to take care of him. So, of course, this patient doesn't get out of the house. So, how does this happen that he gets infected? Of course, as I've described this virus before, I consider it a sneaky virus. To highlight this, I want to just review. There was I think, a very important study done here in Massachusetts, in Boston. It was reported in the Boston Globe last week on Friday. It was with the Mass General Hospital and the Boston Public Health Department, and they looked at 750 volunteers in 4 communities in Boston. That included East Boston, Roslindale, and 2 parts of Dorchester. And what they found, a couple major findings. The first one was that 10% of those Boston residents who had no symptoms already had antibodies to the coronavirus. So, that shows that, still 90% of people are not infected, which means we have a long way to go, certainly in terms of getting to herd immunity. The second very, very important finding here was that 2.5% of these people that had no symptoms when they were screened with a nasal swab PCR test, which would indicate the possibility of an active infection being contagious. They actually found 2.5% were currently infected, which works out to about 1 in 40. And there was one other expert at the Harvard School of Public Health who felt perhaps the 10% number was a little high. Maybe it's only about 4 or 5%, but nonetheless, I think looking around, our local region, maybe 5 to 10% of people, at least in the metropolitan area, are infected. This obviously can be a different number based on the community that you live in, but of course, we're very close to metropolitan Boston, and so it should give us a fairly good indication. And there will be more studies like this going on in the months coming forward, where they'll be doing more widespread antibody testing to try to determine, how far is the virus actually penetrated. But I do want to highlight that fact that 2.5% of the patients had no symptoms, asymptomatic. So that basically means 1 in 40 people. If you came in contact approximately with 1 in 40 people right now, one of them, might be infected. So I think, just continues to show that we have to have some caution about, how we're doing things with social reopening, that it needs to be a slow process, that the virus is really still very active in our region. And, this is data that was accumulated and is only about 1 or 2 weeks old, really, since this particular study was finished. So it's very current information. At our hospital, Bethesda Deaconess Medical Center, the main Boston campus, we're still following the governor's advice regarding reopening. We're still postponing elective procedures. And in general, when it comes to medical care, seeing a primary care doctor, we're doing less routine care now and mostly just focusing on care that might be urgent in nature or have serious, potential consequences for patients if it's delayed. So I think that should still be our guide in terms of seeking medical care. You should go for it if you need it, including the emergency room if necessary. But I would still be resisting the temptation to do routine care that's not urgent. I think there's some very exciting news on the vaccine front. I do think that we have to be very cautiously optimistic going forward about what's going to happen with vaccines. But in the past week, there were 2 reports locally here. First, the drug manufacturer Moderator showed in 8 volunteers that when they gave the vaccine, that the humans who received the vaccines did produce antibodies. So that's a very early first step. Obviously, that company has to go through many other phases of investigation to prove that the vaccine is safe and effective. But I think it's a good sign that the vaccine can produce antibodies. And then this morning in the Globe was published a vaccine expert from Bethesda Deaconess, Dr. Baruch, who's working with Johnson & Johnson to produce a DNA vaccine. He made known some findings they had in studies in monkeys, and it was very interesting. They were able to show if they gave monkeys an infection with the vaccine, that they did produce antibodies from the infection. And then if they also were to give monkeys a vaccine and then expose them to the virus, they were protected from infection. And that the people who, the monkeys that were infected with the virus also, when the virus was reintroduced to them a second time, the antibodies were protective. So, because monkeys are very close genetically to humans, we consider this extremely encouraging that, the monkeys can produce antibodies that definitely protect against another infection. So very exciting news. There's over 100 vaccines now in development worldwide. And so, we'll have to continue to follow this closely going forward to see, when we get to the point where we have a vaccine that's safe and effective. But, we really need this vaccine, I think, to get out of this pandemic. In terms of social distancing, I think it's very interesting. I often refer people to Track the Curve, which you can look at online on the internet. I think if you look back about 3 or 4 weeks in Massachusetts, you'll see that we have cut our rate of new cases in Massachusetts by about half during the past 3 to 4 weeks. So that's a great trend here for Massachusetts. If you look at the United States numbers, however, the curve is somewhat flat, but actually still appears to be rising slightly. So, the country as a whole, we still have a long way to go, I think, in terms of controlling this outbreak. So what should each individual person be doing right now? I think, some experts describe it as you should assume yourself to be infected, that you want to, protect others around you. That's why we wear masks. That's why we social distance. So I think we just have to stick with that for the time being while we still have fairly high rates of infection going on in our local communities. I believe some people are suffering from social distance fatigue. And, I realize that this is the long haul, but I think you should still resist temptation to have casual parties with friends or family and other forms of get-togethers, and just try to restrict your social contacts really to things that are essential for getting food, going to the pharmacy, going to get medical care when it's necessary. So we have to wear masks in public to protect one another. We've got to continue reducing our social contacts, keep a safe distance away from one another. It was very interesting. One expert I heard on TV that this week talked about, with the hand washing, which we continue to emphasize, the people who wash their hands 10 times a day, they had a reduced rate of infection of about 50%. So, continue to do the hand washing, the sanitizing. This is really, a major way of preventing spread, along with the masks, along with the social distancing. And the last thing, I think there was also some information that came from the CDC about looking at sanitizing surfaces. And I think that the experts are still emphasizing that, the main mode of transmission, the main way that this virus is spread really is through respiratory droplets. And that's not to say that cleaning environmental surfaces is completely unimportant, but I would still focus on those other things that I mentioned. Assume you're infected, wear a mask, socially distance, wash your hands. Those would be the main take-home points that we should really be continuing with. And I'll be ready for questions later in the broadcast. Thank you, Steve.
Thank you. That's Dr. Phillip Triffletti. He is an attending physician at Beth Israel Deaconess. He's here to answer your questions. Email us at plymouthinfo@pactv.org. And each day we begin with a health segment, and then we go to the rest of our panel. Today we welcome back Tim Cruz. Tim is the Plymouth County District Attorney. And Tim, since you were last with us, the Supreme Judicial Court sent a letter out to all attorneys advising us that the courthouses will continue to be closed, the buildings will be closed during the month of June. What's happening with your office? And Tim,
Thanks, Steve. I appreciate it. I'm here in Brockton at my office as we continue to socially distance and talk to the people here in our office. Can you hear me?
we can hear you. Thank you.
And we're continuing to work with the guidelines that we're getting from the SJC. That they unfortunately they've been continuing to change as the weeks have gone by, and trying to keep the various courts here in our county clean. Somebody came in contact with someone who potentially may have been infected with COVID. They were shutting courts down. They were cleaning them. So they continue to try to do the best they can. And they make it, obviously, it's a challenge, I think, when you want to bring and open up a public courthouse where you're going to have people from all walks of life coming back in for a variety of reasons, whether they be criminal matters. I mean, civil matters right now are basically non-existent unless there's an incredibly emergency matter that must be heard. Even then, it would more likely than not continue to be telephonic or on video conference. That's how we're doing all of our bail reviews and arraignments and anything that happens in our county, criminally speaking, line. We continue to work with the court system as best as we can, try to expedite these matters, deal with best practices. I continue to talk with my fellow elected DAs here in the Commonwealth. We all spoke again yesterday, trying to take look at the guidelines that we're continuing to get as state agencies, and trying to put together some uniform policies that we're all going to be able to do, so we can continue to social distance, even when the number of people is allowed to go up from 10 to, I believe it's 25. Normally here in our office in Brockton, when you include the state police that are assigned to the Plymouth DA's office, you could have anywhere up to 75 to 90 people. So obviously we're going to continue to rotate people through, work remotely. People are working at home right now, using best practices that not just here in Massachusetts, but Mass DAs continue to work with the national DAs and see what we're all doing and the challenges that we all face. And I think it's a fair statement to say that all things are relatively different because we're all in different phases, whatever your phase may be, 1, 2, 3, 4 in Massachusetts versus what's going on in other states. And I think that makes it a little bit different. But the cases that we have, we continue to deal with individuals who are trying to be released, notwithstanding the fact that they do not have COVID-19, people who are being held on bail. And as you should know, I'm sure you've had the sheriff on before, Sheriff McDonald. He's certainly quick to tell you that, the capacity at the Plymouth County House of Correction is approximately 1,240. Right now, they have less than 640 people who are being held there. And more than half of those people are federal detainees. So you're talking roughly 300 or so out of a population of 515,000 here in Plymouth County are being held at the Plymouth House of Correction. What that means is that he has the ability to socially distant prisoners, making sure that the inmates aren't close to each other. I believe they can pretty much all have their own cell. And right now, as I understand it, as through yesterday anyways, only 2 individuals had COVID-19. And both of those individuals brought it from the outside in. And they have procedures and policies, which I know many sheriffs are using, to quarantine individuals before they're put back into population. So I think that as a result of that, that's why we've seen virtually no numbers whatsoever at the House of Correction, notwithstanding a lot of people saying that the germs be going on. I think they're doing a great job in there. Criminal work, unfortunately, although there's a pandemic, really doesn't slow down. And although I think it's a fair statement to say countywide, including Plymouth, arrests are down, but there is still a lot of things that are going on. And our police, our first responders, the firefighters, the men and women who are out there responding to each of these 911 calls or calls for help are doing a remarkable job in trying to keep themselves and other people safe. And, maintaining public safety is incredibly important, even though we're in the middle of a serious public health crisis. And I think they understand that and what we continue to do. And so when we continue to go, when individuals are arrested and the arrests are down, I believe that we've only had maybe 120 or 130 arrests, i.e. new arraignments here during the course of the last 2 months. Most people are getting summons returnables unless it's a violent case or a domestic violence case or a homicide. A lot of those individuals are being released back into the community and they're getting dates beyond the 60 days, putting us into June and July, when we also have a date, which I don't know if it's really a hard date, but jury trials are allegedly going to start back again in July 1. But I know that right now we're working hard to put our grand jury back together and socially distant, using one of the courtrooms here in Brockton, where we conduct the Brockton grand jury. But as we continue to do our job here, I just want to make sure people understand that we continue to try to make sure that we keep the dangerous people who are there. And there are groups that want very dangerous individuals released. And we see these requests for COVID-19 bail reviews and motions for new trials. I'm talking people who have been convicted of murders, rapes, child molestations, gun traffickings, drug traffickings, things such as that. We'll continue to do our best to make sure that our position of the victims are heard, making sure people are safe. But like I said, we've also been working with other agencies here, trying to deal with the issues that are ongoing in our county. I've been notified recently by the Children's League of Massachusetts, the Massachusetts Children's Alliance, and MOBA, which is the Mass Office of Assistance, reaching out to all the DAs to try to help have the public reach out and let's make sure that we're dealing with ongoing child abuse issues. Because with our kids not being in school, and even though it's online, lots of these kids here in our county and within the Commonwealth are exposed to very serious matters in their own homes or in the way that things that may occur in their neighborhoods. A lot of our mandated reporters, people who are mandated reports of abuse or neglect, are our school teachers, or there are physicians who look at kids for routine physicals, or maybe our clergy, or maybe a therapist. They're all mandated reporters. So if they saw something happen to a kid, a mark, something going on with that child, they're mandated to report that. What we're seeing here, unfortunately, is that over the course of the last month and a half, we've seen our numbers of reports go down, which I think at first glimmer, you would think would be a great thing. In actuality, I think it's just kids aren't being seen. So we see our numbers from a year ago, between March 16th and May 1, we had 161 reports of abuse and neglect in Plymouth County from mandated reporters, 51 A's of report. In the same time period in 2020, we've only had 60. Now, I'd love to be able to sit here and tell you that means child abuse is down by those kind of numbers. I just know it's not. So that, in conjunction with domestic violence cases, which are still ongoing. I mean, you can still pick up the newspaper. There was a horrific case in Dover this week. We've had our own, we had a domestic violence homicide in our county a couple of weeks back. People should understand that there is help out there. And if you are a woman or with their children who's in a domestic violence situation, there is help. First and foremost, if it's an emergency, please do not hesitate to call 911. And if you need help, if you need numbers for a Safe Link or for Health Imperatives, which is located in the Brockton area, or our Jane Doe groups, the people, the agencies that reach out a helping hand to people who need it the most, especially in these difficult times of isolation, of all the challenges that people are facing with job insecurity, food insecurity, there's help there. And if you don't have the numbers, please go to the DA's website, PlymouthDA.com. That's PlymouthDA.com. All those numbers, all those links are there. There is help, and you don't have to be alone. We continue to also see, unfortunately, here in our county, suicides that are ongoing, which I think is the same thing. So if somebody knows somebody, maybe a senior who may be alone, maybe they don't have computers, maybe as long as you social distance, is there a way you can be in contact with them and let them know that we're going to get through this? It's just taking some time, but we will get through this. We all know that. And at the same time, please, the issues that are going on with people who are addicted to drugs, substance abuse disorders, that's also ongoing. There is help. And, the pandemic doesn't stop domestic violence, doesn't stop child abuse, it doesn't stop drug abuse. Plymouth County Outreach has people on call 7 days a week. They have Zoom meetings now because they can't have the normal meetings that they had. Once again, all that information is on PlymouthDA.com. So please make sure that you get that while you can. And lastly, I just want to say that also we're still trying to keep people notified of the scams that continue to go on. And they're kind of scams with a tweak where people are these professional scammers. And that's why they prey on our seniors, who are, I think, much more trusting and good-natured than a lot of some of the other people in our community. And they prey on them and they use them. They bring that scam about your grandson's in custody, he needs cash. They have very good at what they do of getting information from you and extracting from you. If anybody's calling you up and trying to get money out of you, trying to get gift cards, trying to get something which you're going to send it down the road, please call the police. Once you give that information out, we can't get it back. If you get calls from other agencies alleging that they need information from you, your social security number, your credit card number, your numbers, legitimate organizations are not going to ask you. So please just be careful with your information, because although right now we have investigations ongoing with some of the scams that have occurred in our county, although that they still remain difficult to catch these people. And unfortunately, it's very difficult to get monies back from once they're gone. So that's pretty much the uptake here from the DA's office here in Brockton. Thanks for the opportunity, and I look forward to the question.
That is Tim Cruz. He is the Plymouth County District Attorney, and I would just add, Tim, so that earlier this week, my son Franklin and I had a virtual conference with an assistant district attorney from your office in Wareham, and we were able to successfully exchange information, which included video evidence in preparation for a criminal hearing tomorrow at Wareham District Court, which again will be handled telephonically. So the business of certainly your office as well as that of the court continues despite the challenges of COVID-19. So thank you for all that you do. And please send your questions if you're a viewer, to PlymouthInfo@pactv.org. We're going to continue now with Robert Eisenstein. He is a senior living consultant. Welcome, Bob.
Oh, thank you, Steve. Good morning, everybody. Dr. Triffletti had mentioned the term cautiously optimistic, I think talking about the vaccines and the research. And I'm hopeful that I can use the term cautiously optimistic when looking at some of the nursing home statistics this morning. Before I get into the big numbers, one of the numbers that sort of jumped out at me, and I think I've been reporting here, Steve, for about the last 3 or 4 weeks. And what was happening is, according to the numbers that I have, the number of deaths was increasing about 600 on average every week. For example, from May 1st to the 8th, we had an additional 638 deaths, people pass away in nursing homes. And then again, from the 8th to the 14th, roughly 600. The numbers that I have this morning from May 14th to May 20th is significantly decreased. There was only 363 new deaths, people passing away. Again, I'm cautiously optimistic because we all know with the number of testing going on that you can't really predict long term. But I think that speaks to a number of things that we are hopefully getting through. We talked about the surge in the hospitals, for example, and if we're seeing the same pattern that happened in hospitals, again, fingers crossed, we may actually be moving through the surge, so to speak, that we've seen in nursing homes. We've done a ton of testing, just to give you some of the numbers that we're at right now in the total facilities, and this includes, again, all rest homes and assisted living and independent living, as well as skilled nursing. There was a total of 733 facilities with over 46,000 tests being done, and that's both mobile tests and on-site. That's both residents and staff. So, and just to give you a little example about it, I've heard some feedback, some sort of from the field with some of the facilities that I'm personally involved in. And there are some glimmers of hope out there. Where I'm familiar with our island home on Nantucket, for example, that has had 0 COVID cases in their building for close to 3 months now. Amazing work. Bay Path in Duxbury, another facility that I've reported to have 0 cases. Holden Rehab out in the Worcester area, also a very low incidence. I'm hearing from some folks that have had as many as 30 and 40 positive cases when testing has come back. And now 2 and 3 weeks later, they've decreased to, in one case that I'm aware of, only 12 positive cases. So I'm hopeful. Again, you gotta be careful on how we say this, because we need to see some more long-term improvements. But it does look like the efforts that we're all making on behalf of the programs. And one thing I did want to point out, Stephen, let's not forget, we don't talk about this enough. Anybody who's had family member pass away in a nursing home, it goes without saying, but we do have to say it all the time. Our hearts go out to you. It's, one death is too many, and sometimes, I'm in a position of reporting these numbers, and it's very difficult. But I want you to know that I personally know people and family members. People call me all the time, and it's a very, very tough situation for those who have been, unfortunately have had a family member pass away in a nursing home. Again, our condolences, our hearts go out to you. But hopefully, we're moving through this. What's happening along with this sort of movement going through? The Center for Medicare and Medicaid Services, which we fondly refer to as CMS, came out with an Opening Up America guideline that's following along with President Trump's program. They put out some memos on May 17th, and what they're looking to is a transition to actually reopening nursing homes, which is terrific news. All of us who've been involved in this are, very frustrated. It's very hard. You can't have visitors. You can't see your loved one. They're going to start making exceptions, for example, for compassionate care. If someone is at the end of life under very strict precaution guidelines, they're going to allow some of the visitations to open up. Now, one thing I wanted to point out, the local State Department of Public Health has not vetted those guidelines yet, so we still have to wait for them to put out the local Mass Department of Public Health guidelines. But from CMS, they're going to be looking at, for example, how long a facility has been COVID-free in total. I think they're going to use, give or take, about a 28-day period. where they're going to monitor a facility that has been totally COVID-free, and then with phasing, allow them to perhaps start opening up to visitation. The other thing that was announced, which is excellent news for those of us who are out in the field, FEMA is going to begin offering 2 7-day supplies of protective precaution equipment with the famous PPE that we all talk about. They're going to be providing eye protectors, gloves, gowns, and masks to the nursing homes. The first 7-day supply should be arriving sometime this week, and then the rest, the second 7-day supply should be arriving sometime next week. So again, they're cautiously optimistic, as I said before. One of the struggles we still have, and I think I reported on this last week, due to the increased testing, unfortunately, if an employee is tested positive, they also have to stay out of work, and that there's a minimum of 10 days for being on leave if an employee is tested positive. In some cases, these folks are asymptomatic, but they've been exposed, and we have to take precautions. So I put out a plea last week. If there's any nursing staff out there that are laid off from the hospitals, for example, or anybody looking for employment, we'd be happy to try to hook you up with the portal on the state portal on the Department of Public Health. And we're desperately looking for some help in that area. But again, it's positive that the federal government has put out a phasing. It's going to be phase 1, 2, and 3. It's only when you get to phase 3 with certain precautions that you'll be allowed to have visitors back in the building. But there are a couple of facilities that may actually be able to start reopening very soon. So, thank you again for the opportunity, Steve. And if there's any questions, I'm always open to answer any questions at the end of the presentation today.
Thank you, Robert Eisenstein, Senior Living Consultant from Plymouth. This time we're going to move to our business part, and we're going to welcome Stephen Cole. Stephen is the Executive Director, Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hey, Steve. Glad to be back. If it clears, I hope I'm coming through okay. I see some chunkiness on my internet connection. If I break up and you have to cut me off, I'll understand entirely. But as I was saying, if it's Tuesday and Thursday, we oftentimes hear from Mark Twain from Beyond. And today I want to share with you a thought that I was having with regard to one of his quotes I recall reading a while back. You can't depend on your judgment when your imagination is out of focus. Change can be frightening, and the temptation to resist it, to judge it as unnecessary, it's natural. It may be a little understanding. But we don't do this show to reinforce people's nature and what their gut feeling is. We're here to encourage people to use the information they receive, to learn new things, to rethink processes, and to improve the way we work.
Yeah, just go
It's
back
not
to that.
necessarily pleasurable to sit here and tell business owners to beware the eyes. It's not necessarily enjoyable to tell people to not wheel in the Trojan horse. No one throws a parade because the soothsayer was right. Regardless of someone's personal judgment on whether they like the new guidelines or not, I want folks to think about these regulations as quality control assurances. And imagine a worst scenario if quality and safety is not assured. We see assurances on daily products we buy from manufacturers. Even on toothpaste, you can see FDA approved. That is intended to give the consumer confidence that the product is safe. The Plymouth Economic Recovery Task Force is assisting with implementation of some of these guidelines to help businesses overcome some of the barriers. Signage will be incumbent on us so that we can educate guests, customers, employees to what the new protocols are. Businesses will have to be innovative. You have to reserve judgment and use your imagination to solve some of these problems. I want to call out Angelo's famous roast beef. Very clever solution to a problem. When you walk in there, you'll see the solution that they set up so that you can transmit cash or payment and receive your food safely. There's another couple of restaurants that I saw highlighted from some of the magazines that I follow and read. The Dutch right now are creating a glass box or a cake around each table so that customers can have that sense of intimacy, and they serve food on a long board, something like what we see on a pizza, like a pizza spatula, right? There's no shortage of innovation that I think people can look at and adapt to themselves. But I guess the message I want to bring home to folks today is simply that your judgment cannot cannot impede the progress of what we're trying to achieve through these broadcasts. There are some businesses in town that are a little slow to adapt to these new practices, these best practices. Please be mindful of how your role is part of something much larger in this community, including our economy. So I'll stop there, Steve. I'll have some fun announcements to make at the tail end of the broadcast. But for today, I want folks to realize that these policies are coming down the pike, not to cause problems for anyone. They're intended to keep us all safe and to instill in us confidence that it's safe to participate in the economy again. Thank you, folks.
Stephen Cole, and he is the Executive Director of Plymouth Regional Economic Development Foundation. Steve has been with us each Tuesday and Thursday, and the Plymouth Area Chamber has been with us each Monday, Wednesday, and Friday. We've also had participation from the Canal Region Cape Cod Chamber, and this afternoon, the Canal Chamber is going to be offering a free webinar. The information we're going to put up on the screen, and it is for Zoom training. So for all of us that have been participating in Zoom activity and would like more information or training this afternoon from 2 to 3, you can contact through the information that's shown on the screen or through the Canal Region Chamber of Commerce, and it's free to all viewers. At this time, we're going to go to Matthew Muratore. He's the Plymouth State Representative. Welcome, Matt.
Hey, Steve, how you doing today? I think you and I and Ken could probably do these Zoom trainings for everyone as well. We've been doing so many of them. It's a new norm, though. I think it's going to be one of those silver linings that's going to come out of this whole thing is we're going to be doing more and more meetings like this as we move forward. I don't know if it was coincidental or not, but when Stephen started talking about Mark Twain again, I saw Ken get out. I don't know if that was coincidental that Ken got up and is tired of Mark Twain or what, but anyways. All right, sorry. So let's look at some numbers. I want to follow up on what Dr. Triffletti was talking about. Right, the numbers are trending in the positive direction. If you look at the 7-day weighted average of positive tests for coronavirus, that's dropped 67%. If you look at the 3-day average of the number of COVID patients in hospitals, that's dropped 30%. And if you look at the number of hospitals using surge capacity, that's dropped 38%. And what Bob was talking about with regard to deaths and nursing homes, when you start looking at the death overall, the 3-day average of COVID deaths has dropped 44%. So we are trending in the right direction. We do need to increase the capacity of testing, which we are working towards that. We're looking to do up to 35,000 per day starting in July and 75,000 by the end of the year. Yesterday, we did another 13,000 tests. There were 1,045 folks who confirmed positive. That's 8%. So now we're getting into single digits, whereas a month ago we were somewhere closer to 28, 30%. So the testing of people is happening. The number of those being confirmed positive is going down, but unfortunately, deaths are going up. We had another 100 deaths overall yesterday. But if you look at the averages going back, it is improving in that area. With regard to Plymouth County, and I think somebody alluded to that, it might have been Tim Cruz, that we're still in somewhat of a surge in this area. Numbers of Plymouth County still going up. We had another 172 positive cases. We're up to 7,280 in Plymouth County. In the town of Plymouth, we're up to 414 cases. Another 17 were added from yesterday with 25 deaths. Another one was added. In Plymouth County, the number of deaths is now up to almost 500 to 481. So, and then when you look at the hospital, BID Plymouth, they're still up there with the amount of confirmed or suspected confirmed cases, 3 at the hospital as of yesterday, with 7 of those in the ICU. Overall, the hospitalizations, the number of capacity in the beds is still 50%. And so as Dr. Triffletti said, don't hold back. If you need something, call your PCP, or go to the hospital if you need to, go to the emergency room. And pretty soon we'll be opening up for a lot of surgeries. We're not there yet, but at least if you need something preventive, don't hold off. So please go to the hospitals. One thing I wanted to bring up about businesses there is going to be, and this is for businesses as well as people who visit these businesses, whether they are going to be restaurants or office space or whatever. Everyone must comply with the mandatory safety standard, the standards that are established, and also they're going to be specific industry guidelines that every business will have to abide by. And there's going to be 3 documents that we have to have. They're going to have a control plan, and there's a template on the mass.gov/reopening site that could give you a template of the control plan. And that needs to be available when an inspector comes in to show it to them. The second thing a business is going to need is a compliance annotation poster that affirms they have this plan. So that's all they're going to need to do is have that plan up there saying that they have a poster up saying they have that plan. It must be visible to the employees as well as to those that come into your establishment. Again, whether you're an office, whether you're whatever business you may be. And there should be another poster that will talk about the social distancing and wearing a mask, et cetera. So those are going to be some of the norms that will need to be done. One last thing, Steve, is that we were in session yesterday virtually again, and we voted on a bond bill. It was a little over $1 billion bond bill. A lot of it had to do with IT technology. We need to put more resources into IT for the Commonwealth, throughout the Commonwealth. I mean, we're finding that now, living in this new age, that we need to do that. More local to home, there was $200,000 that I was able to put in and get for the town of Plymouth for a fire communication. So that is in the bond bill that the House. We also received in that bond bill $36.5 million for food programs. This will be for the entire Commonwealth, but we know what's happening with food programs throughout the Commonwealth. So there's more money being put into those programs to help support people that are in need of the food. And there's also another $40 million that was put into remote learning. As we know, there's been a lot of remote learning going on, both on the high school or the grade levels, as well as the college levels, university levels as well. So some more bond money will be coming out from them. This House bill will the Senate, and hopefully the Senate will approve it as well. So that is the update that we have for today, Steve. So it's back to you.
Thank you, and that is Plymouth Representative Matthew Muratore. He and the members of our panel are here to answer your questions. You can email us at plymouthinfo@pactv.org. We'll be with you again next week on Tuesday following Memorial Day holiday. We'll be joined by Sarah Cloud. She's the Director of Behavioral Health and Social Work at Beth Israel Deaconess Plymouth campus. Also by Dr. Barry Potvin, who is a local epidemiologist and professor from Yeshiva University Department of Biology. Also Michelle Brady, she is the Director of Elder Affairs. Stephen Cole, the Executive Director of Plymouth Regional Economic Development Foundation. This time we're going to go to our questions. Our first question is for Kenneth Tavares, Chair of the Board of Selectmen. And Ken, viewer Jane writes and asks about the Plymouth beaches. She wants to know, are they opening on Monday? If so, what is the procedure for parking? If not opening Monday, what is the proposed date for opening? And can people also go to Stevens Field and launch kayaks if they wear masks and if social distancing rules are followed?
The question on Stevens Field is yes, you can certainly launch a kayak from there, and there will be parking. It should be sufficient parking. Plymouth Beach is entirely different. The parking lot will remain closed until June 13th, as many of us have been watching. There's major reconstruction work going on at Plymouth Beach, so it will not be ready to receive anyone this weekend. If you can walk to the beach, you can certainly go on the beach, but there will not be parking available.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. We're next going to go to Dr. Phillip Triffletti. Dr. Triffletti, viewer asks, we're hearing different opinions from doctors at the national level as to what to take or what to follow. How do viewers decide who to listen to? And you're on here each Thursday. where do we go to know that the information that we're receiving is accurate and verifiable?
Thanks, Steve. That's a very complicated question. What are the best sources? I do feel that a lot of the national leaders that we have, like Dr. Fauci, Dr. Birx, the head of the CDC, the head of the FDA, I think they're all doing a fantastic job, leading us through this pandemic. A lot of times you will, on different media sources, get different opinions about things, but I think that sticking with a lot of these national medical leaders is probably your best bet, when you're trying to go through these issues. If you're referring also to President Trump's decision to take hydroxychloroquine to prevent COVID infection, I think you've pretty much seen almost unanimous decision from medical experts that that's not warranted to take that medication at this time. There's been no studies of this medication preventing COVID infection, and the studies that have been done looking at its effectiveness as a treatment for COVID for people who are infected, have not been successful. So right now that medication is not recommended, even though the president is taking it. It doesn't fit with the scientific evidence right now.
One other question for Dr. Triffletti while we have you on the screen. When will we know the impact of relaxed social distancing in the states that have done it?
Great question. I know you have a few epidemiologists that also participate on this cable TV show. And, the epidemiologists, of course, the best experts on trying to predict these impacts. But I think what you'll hear from them is that the effects of a cascade of infections that might be triggered by, relaxing the social distancing, it really probably would take a month or two to see the impact of sort of reigniting the fire and having a spread of infection. You won't see it in a few days, you won't see it in a week, but probably within 1 to 2 months you will see these effects. I believe that it's very possible that in those communities where they haven't satisfied all the recommended criteria for when to do the social reopening, I do feel there's a pretty high risk that they will, in a month or two, see increasing rates of infection in those communities.
Dr. Phillip Triffletti is an attending primary care physician at Beth Israel Deaconess Boston campus. We're next going to go to Tim Cruz, Plymouth County District Attorney. Tim, a viewer writes that last week she received a scam as a member of a local church that was received by all the members of the church in Plymouth. And at the time she knew it was a scam, so she didn't respond. But later found out that one member actually was scammed. It had to do with gift cards, and another member went out and purchased gift cards and forwarded some of them. And the question from the viewer is, number one, do they contact the police or your office? And number two, would it be appropriate for members such as this of a group to immediately contact the group and at least let the group become aware that the member believes that the group is being scammed?
Yes, Steve. I mean, I think you should reach out to the district attorney's office as well as to your local police. We all work together so that when we had a scam, one in Hanover, one in Rockland, all those police officers are working together, working in conjunction with the state police. And if many times these scams go beyond the county of Plymouth, so you have to sometimes reach out to the AG's office, or if it goes federal, depending upon the amounts of monies, you have to work out with the U.S. Attorney's Office to try to chase down these guys. So whenever you get something like that, yes, I think you should always notify your friends, your families, your members of your group, your church, whatever. You get one of those, make sure you say, hey, this is a scam, be careful. Because even though we always try to talk about it and publicize it and get it in newspapers and on the internet, many people, for whatever reason, they miss those stories and they're not sure of the fact what's going on. And there's a lot of really good people out there who are going to be taken advantage of by individuals who are not so good. And their job is to really talk you out of your money, whatever that scam may be, of cash, of gift cards, of money cards, of wiring, transferring money across the country. So yes, if you get an email that says something like that, or a text, or a letter, usually it's going. You can tell by looking at them. I think we all win those lotteries online, which we've never played. And I always tell people, if you didn't play the lottery, you didn't win it. And even though they're always going to be in a position where they're going to tell you, you've won this, and they try to get people's interest up by making them offering large sums of money. If they reach out to your friends in your circle and tell them to be careful. We do have a lot of good banks and a lot of convenience stores and supermarkets that sell the gift cards, or are notified and do know that if somebody comes in and asks for a large sum of money and it's a normal customer and it just seems unusual, they're going to ask them, is somebody forcing you to do this? Is somebody making something going on? It's important for that to happen. We need to all protect each other. These people are good at what they do. So notify us, notify the police, and notify your friends. And I think the more word that we can get out about these scams, the more we're going to be able to stop.
Tim Cruz, Plymouth County District Attorney, Robert Eisenstein, Senior Living Consultant. Bob, of your rights, we know that the nursing homes and assisted living facilities in Plymouth are not receiving visitors. How do you recommend that there be appropriate contact with residents in these communities?
Can you hear me okay?
Yes.
Okay. I think most of the nursing homes will have an identified contact person to talk to make arrangements for remote communication. I know a lot of them, there was actually a state program where they were giving out handheld devices to all the nursing homes. They're also doing drive-ups to the windows. They're really taking, trying to be as creative as possible to assist with communication. So my recommendation is call the facility directly, get a hold of somebody that can make arrangements for a remote visit, and they will take care of it. And if you have any problems, you can always call me.
Thank you, Robert Eisenstein, Senior Living Consultant. Each day we have each of our panel participants close with a statement as to what would be a good thing to remember today. We're going to begin with Stephen Cole. He's the Executive Director of Plymouth Regional Economic Development Foundation. Steve, what do you want our viewers to remember?
Well, I'm going to revisit some of what I shared on Tuesday. We all know that some of these regulations and requirements are going to cost money to implement. As I mentioned earlier, too, new signage is going to be incumbent on businesses opening. So on Tuesday, I had given a soft tease. I'm going to give another soft tease today. On Friday, we are going to launch through the Economic Recovery Task Force the Quarantine Crazy Hair and Beard Competition. We know when barbershops are going to open. We know that it's going to take a little time for some of us to get an appointment in order to get a little more spruced up. But those folks who let their face and their hair go crazy, they deserve to be rewarded and identified. Similarly, those folks who were able to keep themselves together and nice and clean shaven, like our own state rep, Matt Muratore, he should probably be identified and rewarded too. So I want to tell folks at home that this is a fundraiser event to assist small businesses cover the costs to adapt to the new regulations and requirements in the aftermath of COVID-19. We are partnering with the Chamber of Commerce, Plymouth, the Economic Recovery Task Force, as I mentioned, and we are lining up some salons and barbers to assist us as judges. Plymouth County residents are invited to submit a photo of their hair and or beard grown during the COVID-19 lockdown. There's a $10 entry fee that will be assessed, and the collected fees will be used to assist small businesses to adapt to these new regulations. The focus of each photo should be your hair and or your beard grown during the lockdown. Photos should be taken from between, let's say, March 13th through June 30th. We'll make an announcement on the winners on Friday, Friday, July 3rd, and that will give folks some bragging rights heading into the 4th of July weekend. The top prize will be a $50 gift card to a Plymouth-based salon of your choice, and runners-up may receive a consolation prize, perhaps a bucket of beer. So we're working on some of the details. We'll have those fleshed out by Friday, tomorrow, when the competition officially launches. You can send an email to me, stephen.cole@plymouth-ma.biz. Get an early start on the competition. Thanks, Steve.
Thanks, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. We're going to go now to Dr. Phillip Triffletti. Phil, what would be a takeaway today?
Well, the first thing I want to say is that clearly our practices of social distancing, wearing masks, our hand hygiene, all of these things we've been doing has helped us decrease the rates in the state of Massachusetts. And so we're doing great work. We have to stay the course, like the old adage of the metaphor about it's a marathon, it's not a sprint. We've got a long way to go. I mean, some experts think we're only in the first few miles of this pandemic. And some of those statistics I quoted earlier showing that in some of the most heavily impacted communities, you might only have 5 or 10% of people are infected. Until we have a vaccine, that may have to grow to 50 to 70% before the pandemic actually ceases. So we've got a ways to go. We have to keep trying to do the right things. I think you should try to do the things that you can do. So when Ken Tavares was talking about, yes, you can go put your kayak in, great. I know Matt and I are both passionate about playing golf. I think that's something else that you can do safely as an activity. So, try to do the things that are still safe and social distancing yourself from others. And then lastly, just to repeat what I said on the last broadcast, instead of just counting the days, make sure that you make every day count during this time. Thanks, Steve, for having me.
Thank you to my brother, Dr. Phillip Triffletti, attending primary care physician Beth Israel Deaconess, Boston campus. We're now going to go to Plymouth County District Attorney Tim Cruz. Tim, what would be your closing statement today?
Well, thanks again for having me on. I appreciate it, and I appreciate all the words of everybody that's trying to keep the public informed. And we just briefly say, we're almost through this. Let's continue to work together. Let's be safe. And I think that we're going to be better for this when we get through this. We're all working together right now. We're going to continue to do that. And we'll continue to make sure if you need help, remember, there are people out there that can help. There are agencies that can help. And if you don't have the numbers, please, reach out to your local DA's office or AG's office and get the information, and we'll get through this. Thank you.
Tim Cruz is Plymouth County District Attorney. We're now going to go to Robert Eisenstein, Senior Living Consultant. Bob, what should we take away today?
Well, thank you very much, Steve, for having me on again. I think a couple of quick things. Number one, hopefully we're moving through the worst part of the pandemic in nursing homes. But what is going to happen, unfortunately, we're going to have to go probably much slower than the rest of the community in terms of reopening. Because of the vulnerability of this population, infection control protocol is critically important. And I think we're going to see some of those new protocols that we're putting in place are going to become permanent. And so I would just caution people to be extremely, extremely careful, particularly when dealing with nursing home residents. The earlier caller asked about remote visitation. We can be very creative, but it may take a while to reopen for some of these facilities. And then lastly, again, I keep putting in a plug for staffing, but I also wanted to give a shout out to all of the nurses and the CNAs and the administrators who've been, I have friends and colleagues, and I think Matt Muratore does as well. They've been working just, tirelessly hours. Some of them are positive themselves, and they're trying to do all the good work on behalf of the community. So my heart goes out to them, and let's just keep plugging away and hope we get through this together as a team. So thank you, Steve.
Robert Eisenstein, Senior Living Consultant. We're going to go back now to Plymouth State Representative Matthew Muratore. Matt, we've done 50 of these daily updates. You've been here for 49, plus you did a regional update. And Bob Eisenstein's telling us you also have some friends and colleagues. How do you want to close today?
Yeah, Bob's right. We know a lot of friends and colleagues who are, they're a lot like firefighters and policemen, and, they're running into danger, and they are doing that now, and our hearts go out to them. A lot of them have become positive. Fortunately, I don't know anybody personally who passed away from it, but we do know about the residents that have. Many of them, as we've talked about, 61% have died in long-term facilities. I want to close today by just reminding people some of these numbers. 60% of those folks that have tested positive have passed away. Of those folks that have passed away, 95% of them are over the age of 60. And 98% of them have underlying health conditions. So if you are over the age of 60 and you have underlying health conditions, please, please, please stay home. There's no need for you to go out unless you need groceries or if you have to go to the pharmacy and you have no other way to get there or nobody to help you. Please wear a mask to do that. We are the 4th hardest hit state next to New York, New Jersey, and Connecticut. So we need to keep that in mind. So the opening has to happen based on data and not dates. So we need to continue to do what we're supposed to be doing. Stay informed by going to mass.gov/COVID-19 or mass.gov/reopening to hear about the reopening plan. Ask questions by calling 211. Get text alerts by text COVID-MA to 888-777 or COVID-MA ESP in Spanish to 888-777. And if you have questions, you help buoy.com/mass for health questions. Stay home if you're over the age group. If you are heading out though, wear a mask. Please be safe. It's for you and for others. We will, as everyone's saying, we'll get through this and stay calm. Again, the more we come together by staying apart, the quicker we'll get back to the people we love and we love to do. Thank you very much, Steve, and to PAC TV, and a big shout out to all those essential workers that keeping us healthy, and all those workers that are keeping our economy healthy. Thanks, Steve.
Thanks to Plymouth State Representative Matthew Muratore, to all the members of our panel, Dr. Phillip Triffletti, Plymouth County District Attorney Tim Cruz, also to Robert Eisenstein, Senior Living Consultant, Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation, Ken Tavares, Chair of the Plymouth Board of Selectmen. We're coming on a long holiday weekend with a good weather forecast. What are your closing comments?
Well, I want to remind everyone that there are many things that you can do in the town of Plymouth. Use common sense, stick to the protocols, and I think you can have an enjoyable weekend. It is a significant day, Memorial Day. We will be observing it in a different manner than we ever have before. But we can absolutely do this. I want to go back to the beaches. Plymouth Beach will open hopefully on June 13th. That is depending on the construction and if there aren't any delays. So the people that have been working on the beach, repairing the wall and the parking area, have been working very, very hard, and we hope to meet that June 13th deadline. There is a great deal of detail on the plymouth.gov site with information on all of our recreational areas and beach. You can go to that and it'll give you all the detail that you need. I appreciate the work of so many in the town that are working diligently to open up these areas. We will do it. It'll take some patience, and it's going to take all of us working together. Thank you. Have a good weekend.
Thank you, and that's Kenneth Tavares. He is Chair of the Plymouth Board of Selectmen. We'll be returning on Tuesday, at which time we welcome Sarah Cloud. She's the Director of Behavioral Health at Beth Israel Deaconess in Plymouth. We'll also be welcoming Dr. Barry Potvin, who is the local epidemiologist. Michelle Brady is the Director of Elder Affairs for the town of Plymouth. Steve Cole will be joining Ken, Matt, and me. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.